I'm a first-year student from the Zaporізький State Medical University, and I want to show you our work about benign and malignant ovarian tumors, modern evaluation criteria and treatment tactic in women of the reproductive age. In recent years, the incidence of ovarian neoplasm has increased, especially age. As a result, the number of the reproductive system is increasing. Factors which increase the risk of developing tumors: the absence of pregnancies in anamnesis, simulation of ovulation, endometrioid ovarian damage, a history of ovariectomy, and other. Mainly, the zinc malignant tumors are most often detected at the 3 and 4 stages. Code for ICD-10 is D27, is a benign ovarian tumor. It's known that the range of complaints may vary from asymptomatic forms to the clinical. Simple rules of the internal ovarian tumor analytical group IOTA thinks of prognosis of benign tumors. It's an unilocular cyst, presence of solid component, presence of acoustic shadow, small multilocular tumor, and no blood flow. Thanks for prediction of malignant tumors, irregular solid tumor, presence of ascites, at least 4 papillary structures, irregular multilocular solid tumor, very strong blood flow. Specialists of the group IOTA divided all tumors: unilocular cyst, unilocular solid cyst, multilocular cells, multilocular solid cysts, and solid tumors. It is recommended that you follow standard terms when describing your formation: the presence of membranes, things of the membranes, incomplete membranes, solid tissue, papillary projections, and other. In some cases, only complex investigations, ultrasound, MRI, CT, help to determine the correct diagnosis. During pregnancy, additional things of the malignant process are parameters of ovarium greater than 10 centimeters and an increasing in their size by 3.5 centimeters per week. They perform two analyses of detection of ovarian tumors in women of reproductive age and to analyze therapeutic tactics and morphological findings was our purpose. And methods. We analyzed 38 cases of patients of reproductive age at the Zaporіжжя Perinatal Center in 2016-2017 years, in which benign tumors and tumors of the ovarian were identified and underwent surgical treatment. History features. All surveyed women were aged 15-38 years, menstruation from 12 years, menstrual disorder had 2 patients, anamnesis of 8 women had childbirth, 2 of them by caesarean section. 4 had abortions, 1 had an ectopic pregnancy. Half of the surveyed didn't work. We found that all patients were hospitalized, which 24 had complaints of pain, weakness, and menstrual disorder. We also found extragenital pathology. It was the most high value of dysautonomia, gastritis and duodenitis, and congenital heart defects. In case features, 6 patients were found CA 125. In their cases, the values exceeded the normative values. HE4 was found in 1 patient, which was within normal limits. According to the international protocols, all patients with ovarian tumors are advised to have a gastrointestinal examination before surgery. And during gastroscopy, we found esophageal duodenitis and other. Colonoscopy was performed in 12 cases, and we found dolichosigma, dolichocolon, chronic colitis, and irradiated colon, and other pathology. X-ray examination of the gastrointestinal tract revealed that in 3 cases were gastroduodenitis, in 1 case insufficiency of cardia, esophageal hernia, and dolichosigma. Ultrasound. A transvaginal ultrasound was performed for all women. The size of the uterus was 48 on 38 and 37. The MHO was 7.5. The maximum size of the right ovary was 113 millimeters, and the maximum size of the left ovary was 193 majority you can see on this diagram. On gluten cyst, popular cysta adenoma, and teratoma. Diagnosis of hospitalization was ovarian cyst in 25 cases, cystoma, benign tumor, and infertility in 4 cases. 4 women were hospitalized for her 9 weeks of pregnancy, in whom during USG neoplasm has been figured with CA 125, was consulted by oncogynecologist in the Zaporіжжя Onco Center. An operation was performed. The result of her analysis was serous cystadenoma. A woman who has in analysis history resectoscopy with a cyst of more than 1 year during USG was assessed as follicular scopy. A tumor was detected. The reproductive potential, it is necessary formations. Take into account analysis data and recommend regular ultrasound examination at-risk women. Before surgery, it is necessary to do diagnostic of gastrointestinal tract and to use organ-saving operation technologies because we need to save.
We don't hear you. Try to disconnect and reconnect. Okay.
I have a question.
Can you hear me?
I have one question to you. What was the level of mortality of young women?
I'm sorry, can you repeat your question?
What level of mortality of young women with such pathology? Level mortality. Okay, I have next question. 7 patients have erosion of upper antral department, yes? What etiology of this disorder? This is influence of treatment or the?
All the women was in department of gynecology, and they have treatment from
Okay, thank you.
Hello.
Yes, please, your question. We'll listen you.
Okay. Please, can you tell me what are the like correlation between this ovarian tumor with the pregnant woman? Like some woman is pregnant and further she got some complication like ovarian tumor. Like what will be the management of this in this situation?
Disease.
Hello?
Hello.
Yes.
There was the same symptoms in women with pregnancy and.
No, I'm asking about the management. How will you manage in that situation when the woman is pregnant?
Then we do the same diagnostic and some tests are regressing from after labor.
So you can type your answer and question in the chat if you have the problems with satellite and connection. Or if there are no questions, thank you very much, Dar'ya.